Many people get gallstones and experience severe and sudden pain in their upper right abdomen, and the result is emergency. According to a report of the National Institute of Diabetes and Digestive and Kidney Diseases, 10 to 15% of Americans have gallstones. Some risk factors are out of your control, like genetics, age, and sex. The happy news is that you can prevent your risk of developing these hard, pebble-like pieces of material that form in the gallbladder. What are gallstones actually? Gallstones are actually hardened deposits of fluids that form in your gallbladder. You might not even know you have gallstones until they block your bile duct, causing pain that needs immediate medical attention. You may have cholesterol stones, which are the most common and are usually yellow-green in color, and pigment stones, which are smaller and darker and are caused by bile or fluid stored in your gallbladder. Ways to prevent gallstones. Gallstones can be prevented with some simple changes in your lifestyle and diet. Here are 4 ways to help you stay fit to prevent your risk of developing gallstones. Number 1. Regular exercise. Obesity is one of the top lifestyle predictors for gallbladder issues, according to research published in April 2012 in the journal Gut and Liver. Obesity is a dominant factor in a person's health and increases the risk of stone formation, says Field Willingham, MD, Associate Professor of Medicine in the Division of Digestive Disease at Emory University School of Medicine in Atlanta. If you are overweight or obese, the best thing you can do for your health is to lose and maintain a healthy weight, he says. Guidelines from the US Health and Human Services recommend that regular physical activity, at least 150 minutes per week or 30 minutes 5 times a week, can improve health outcomes and prevent weight gain. Number 2. Lose weight. The most effective way to prevent gallstone disease in the long term is to control one's weight. But rapid weight loss, bariatric surgery, or participating in very low-calorie diet programs, less than 800 calories per day, can actually increase the risk of developing gallstones, says Amit Joshi, MBBS, PhD, Instructor of Medicine in the Clinical and Translational Epidemiology Unit at Massachusetts General Hospital in Boston. Eat healthy. Here are some tips for what types of food you should eat and what you should avoid. Stick to healthy fats. The mono and polyunsaturated fats are good, found in olive oil, canola oil, and omega-3 fatty acids, which are found in avocados, canola, flaxseed, and fish, are beneficial in preventing gallstone disease. Please stay away from saturated fats found in fatty meats, butter, and other animal products, as these fats can increase your likelihood of developing gallstones and high cholesterol. Among other health risks, choose low-fat alternatives to red meat and whole milk such as lean chicken, skim milk, and low-fat yogurt. Get fiber from fruits, vegetables, and nuts. Diets rich in fiber from whole grain, bread, and cereals, fruits and vegetables, and plant sources of proteins such as peanuts, walnuts, and legumes help prevent gallstone disease. Snacking on almonds is a healthy way to ease hunger and help you lose weight. Avoid sugars and carbs. Sources of carbohydrates such as white bread, white pasta, and refined sugars may contribute to a higher risk of gallstone disease. Stay away from sweets and choose low-sugar food alternatives when possible. Drink coffee. In fact, a study published in 2015 in the journal Alimentary Pharmacology and Therapeutics found that coffee consumption significantly reduced the risk of gallstone disease, which may be due to the caffeine stimulating gallbladder contraction and the flow of bile. Number 4. Take preventative medication. In individuals with a high risk of gallstone disease, such as those undergoing weight loss surgery, doctor says that drugs can be used to prevent gallstone formation by dissolving them. Gallstone problems can also be prevented by avoiding certain groups of cholesterol, lowering drugs, and hormone replacement therapies such as post-menopausal hormones or oral contraceptives. Anyhow, you should consult your doctor for gallstone preventative medications. When to visit a gastroenterologist? You should immediately visit your doctor when you have the following symptoms: sudden intense pain in the upper right and center of your abdomen, back pain near the shoulder blades, nausea, vomiting or high fever with chills, yellowing of skin and eyes. Gallstone pain can last several minutes to few hours. It is generally treated with gallbladder remove surgery. However, consult your gastroenterologist if you experience any of the above symptoms.